Welcome back. We appreciate your continued participation in the CKD-EDU study. In this video, we'll provide an overview of the different types of dialysis available to patients with advanced kidney disease. We'll discuss the option of conservative kidney management for those who choose to focus on symptom control and quality of life without dialysis. You'll learn about hemodialysis, which can be performed either in a clinic or at home, and peritoneal dialysis, which offers more independence and flexibility for patients. Feel free to refer to your cheat sheet or study manual as you follow along. Some patients may opt for conservative kidney management, focusing on symptom control and quality of life without dialysis. This option is often underutilized, despite the fact that many older people with CKD wish to focus on quality of life without dialysis. This approach requires close collaboration between nephrologists and palliative care clinicians, where nephrologists focus on slowing down the progression of CKD, while palliative care clinicians help with managing symptoms, preparing advance directives, and providing anticipatory guidance. It is important to note that people choosing this option typically do fine until late CKD, such as having an eGFR of 5 or 6 milliliters per minute, but then there is an acute uremic decline when people develop uremic symptoms, lose weight, have poor appetite, and experience an acute decline in functional status. This decline is a part of the anticipatory guidance from palliative care clinicians and is usually a time for a hospice referral for active symptom management. Hemodialysis uses a machine to filter waste and excess water from the blood and can be done at home or clinic. Clinic hemodialysis patients typically undergo this treatment in an outpatient dialysis unit 3 times a week for approximately 4 hours per session. The schedule is either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Home hemodialysis is typically done 4 to 5 times a week for 2 to 3 hours each time. Peritoneal dialysis uses the body's peritoneum as a filter to get rid of waste and excess water from the blood. Patients do their treatments at home, offering more independence in lifestyle and fewer dietary restrictions. There are 2 main types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, or CAPD, involves manual exchanges. It is a do-it-yourself type. Patients manually instill fluid into their abdomen through a PD catheter and then drain it a few hours later. Patients do manual exchanges every few hours, typically 3 to 5 times a day. Each exchange takes about 30 minutes and must be done carefully to prevent infections. Automated peritoneal dialysis, or APD, uses a machine to instill fluid in the abdomen and then drain it. It is typically done at night. Many people do one manual exchange during the daytime as well. All types of home dialysis involve 1 to 2 weeks of training for patients and a family member so they can do it themselves. There is a nurse on call 24 hours a day, 7 days a week in case of an emergency. Patients will need a well-lit room with enough storage space for all home therapy options. They will also need a sink or a drain to get rid of waste fluid. This comparison chart gives you a quick overview of time, schedule, access, and type of machine for each type of dialysis. Please pause your video to read this slide. Some of this information is also present in your cheat sheet. Thank you for your dedication to improving the lives of patients with CKD. Please reach out if you have any further questions.